If you suddenly start seeing floaters or flashes of light, you might be wondering, is this normal or is this something serious? The truth is, sometimes it's harmless and sometimes it's an early warning sign of something that needs urgent treatment. Hi everyone, welcome back to my channel. I'm Dr. Ayesha, an optometrist here in Houston, Texas. On this channel, I break down real eye health questions that patients ask me every day so you can better understand your eyes and protect your vision. Today, we're talking about floaters and flashes, what they mean, when to worry, and what actually happens when you come in to get checked. Floaters are those tiny shapes drifting across your vision. Dots, cobwebs, strings. They move when your eyes move and are more noticeable against bright backgrounds. Inside your eye is a gel called the vitreous. Over time, it becomes more liquid and forms tiny clumps that cast shadows on your retina. That's what you're seeing. They're very common, especially with age or if you're nearsighted, and in many cases, they're harmless. Flashes, on the other hand, look like lightning streaks, flickers of light, or even quick bursts in your side vision. They happen when the vitreous, the jelly, pulls on the retina, and this is often part of a process called a posterior vitreous detachment. This can be normal, but it's also where we start to pay closer attention. Call your eye doctor the same day if you notice sudden increase in floaters, new flashes of light, or a shadow, curtain, or dark area in your vision. These symptoms can be signs of retinal tear or a retinal detachment. In some cases, if traction affects the center of vision, it can even lead to a macular hole or complications related to an epiretinal membrane. If the macula, center part of your vision, is involved, the urgency becomes even higher because that affects your sharp, detailed vision. This is why we emphasize that you do not wait. Do not watch it for a few days. Early diagnosis can be vision saving. When patients come in with floaters or flashes, we don't just take a quick look. We use advanced technology to evaluate, educate, and monitor your retina. Here's what actually happens: a dilated retinal exam. This allows us to fully examine the peripheral retina where tears often occur. Ultra-wide retinal imaging, or Optomap. This captures a large view of your retina and helps us document and show you what we're seeing. OCT, or optical coherence tomography, is an additional test. This gives us a cross-sectional view of the retina, especially the macula, and helps us detect subtle issues like early traction, macular holes, and epiretinal membranes. What's really powerful is that we can show you these images in real time. So instead of just hearing, "Everything looks normal," you actually understand what's happening inside your eye. And if we need to monitor you over time, we can compare these images and track even small changes over time. If we detect something concerning, like a tear, detachment, or macular involvement, we act quickly and refer you to a retina specialist the same day. These specialists are equipped to perform laser treatments for retinal tears or urgent surgical repairs. In many cases, treatment can happen within 24 to 36 hours, depending on the severity. The timing can make the difference between preserving vision and permanent vision loss. Now, to reassure you, if your floaters are stable, long-standing, and not associated with flashes or vision loss, it's usually not an emergency, but it still deserves a proper baseline exam. So, if you notice new floaters, flashes, or any changes in your vision, don't ignore it. Call your eye doctor the same day, and if you're in Houston area, give us a call, because when it comes to your retina, timing matters. If this information was helpful to you, share it with someone who might need it, and follow us for even more clear, practical eye health education.